So hi, I'm Lucy Wightman. I'm Director of Wellbeing Communities and Public Health here at Essex County Council.
Hi, I'm Chris French. I'm one of the heads of public health and I lead on clinical public health services, health improvement and also the trading standard service, and we're currently recruiting for a consultant in public health.
So the consultant in public health will report into me as Director of Wellbeing, Public Health and Communities, but work with our wider team.
I think it's one of the biggest counties in the country, so it's a very complicated system. So they'll be working lots of partners internally and externally, and partners obviously in education and in higher education as well. So I think one of the biggest pieces of work is how we work as a system at the moment. So our system is quite complex across Essex, and we've got 3 integrated care systems that run into Suffolk, Hertfordshire and the 2 unitary authorities in the south. So there's lots of work around integration and how we work better with our partners.
And this role in particular is looking after children and young people and mental health. We've got a really innovative children and young people's contract. It's a long-term contract with a good provider locally. It's outcomes-based, so we're really interested in sustainable improvements in children's well-being that obviously then support them into education and onward. So we've just actually been developing a CPD programme, and that has both internal speakers, where obviously we make sure that we've got the most up-to-date information, we're sharing that with our wider team members and indeed wider Essex colleagues, but also we make sure we've got support from our local academic organisations, so Anglo-Ruskin University, University of Essex, and of course our UXA and OHID colleagues. So where we're making sure that we're meeting CPD requirements, we're also making sure that we're bringing up the next generation of practitioners and principals, and obviously making sure that consultants themselves have opportunities for expansion and growth. So at Essex County Council, we're really flexible in our ways of working. Indeed, I don't live locally, and it's one of the reasons that I came and worked here. It means that I'm able to manage my diary. I'm in 1 or 2 days a week, and then obviously work from home or indeed from another site in Essex County Council, where our partners equally welcome us into some of their hot desking space.
I think, for myself personally, I tend to spend 2 or 3 days a week in the office or based with partners, as Lucy said. So we work really, really closely with external partners, and we sometimes base ourselves with them if we're working on a certain piece of work.
So if you're looking for a job where you're going to be supported to really think innovatively, think outside the box, and really start to consider how we improve outcomes, not just for the people who seek services already, but for our really hard to reach populations. And in Essex, there are many and varied groups that we need to work more with. I'm looking for somebody who really is willing to sort of stretch themselves and stretch the boundaries of public health, so that we can bring in all of the partners we'll need to really make a difference.
I think I'd just say that the team is one of the friendliest, cohesive and supportive teams there are around. So anyone that would come into this role would be well supported, and it's a really, really nice working environment. I think we pride ourselves on innovation. It's a really a team that really, really pushes the boundaries. I think that anyone that comes to work at ETC will learn lots and get lots of chance to influence the agenda.
It's a great team. I'm really lucky. I've been here about a year, and I inherited a really strong team, a very mature team, who are well embedded in the system, as Chris has said. So lots of opportunity to build on really good foundations, but we are happy to take risks. We're happy to push the boundaries. We're happy to work with OHID, UXA and others to make sure that we're really at the forefront of good public health outcomes that not are just in the traditional public health sense, but also stretch into the wider determinants, so working with our wider colleagues in employment, education, growth, etc. And there's lots happening in the wider political world in Essex, so again, making sure that public health is at the forefront of helping to build the new way that Essex will be working.